Multiple myeloma is a plasma cell tumor characterized by excessive proliferation of plasma cells and increased production of immunoglobulins, and it usually affects patients in the age group of 50 to 70, and they usually have generalized weakness and body pain, and investigation will show that they have renal failure, hypercalcemia, and anemia as well. So here we have a 64-year-old male patient who presented to us with a gradually progressive defective vision in both eyes. He also had bone pains and generalized weakness. His vision in the right eye was 6/36, left eye 3/60, with a pseudophakia in the right eye and mature cataract in the left eye. Fundus examination of the right eye showed hyperemic disc and tortuous veins and a lot of hemorrhages, intraretinal hemorrhages, and serious retinal detachment seen inferiorly as well as at the macula. And these findings were confirmed in both eyes by the B-scan ultrasonograph. FFA showed tortuous veins, the pinpoint leaks, block fluorescence because of the hemorrhage, and a silent macula because there was no leak at the macula. The investigations was significant in that there was anemia. ESR was grossly elevated at 120, and the serum creatinine was slightly elevated 1.2. And he also had clinically a soft tissue swelling at the nape of the neck, which was attached to the bone, and which showed osteolytic lesions in the skull X-ray. So with these findings, we thought of multiple myeloma, and we went ahead and did a serum protein electrophoresis, which showed the characteristic M band. He was referred for the bone marrow biopsy, which showed atypical plasma cells, which confirmed the diagnosis of multiple myeloma. He went in for treatment with the chemotherapy, and 4 months later, there was resolving serous detachments. So multiple myeloma is a hematological malignancy in which there is a proliferation of plasma cells and increased production of immunoglobulins, and this can cause hyperviscosity syndrome, which our patient had. He had hemorrhages and tortuous veins and microaneurysms. He also had, because of the deposition of immunoglobulins in the sub-RPE space, there was an osmotic gradient created, which caused accumulation of transudation of fluid in the subretinal space. So, in conclusion, it is important to consider serious multiple myeloma in patients presenting with macular serious detachment involving the macula, and early diagnosis and early chemotherapy can help save the life of the patient and also prevent vision loss due to damage to the RPE and the photoreceptors. Thank you.
What treatment you provided for this patient?
Yeah, he was actually referred to the physician, and he started on bortezomib and immunosuppressive cyclophosphamide and corticosteroids. He was also given injection alendronic acid for the osteoporosis.
This exudative detachment is resolved itself?
Yes, I was showed the V-scan picture. After 4 months of chemotherapy, there was resolving exudative detachment. This patient had exudative detachment both at the macula as well as inferiorly, and he had features of hyperviscosity retinopathy as well as gamma maculopathy. He had all the features.
Thank you.
Is this an isolated case, or have you seen other such cases?
We have
with antibodies.
Your title is a little misleading, epidemic retinitis. You should just have said rickettsial retinitis.
Yes,
Why?
Actually, because Weil-Felix test is not a confirmatory test, because we are not isolating, so it is a presumed, I should have maybe said presumed rickettsial retinitis.
Yes. So because when I saw your topic, I was assuming that you would have included all the post-fever retinitis cases in this.
Yes, only
That's
the
what.
ones
Yeah, all viral retinitis cases, including